Hey everyone, Amy Wood, joined by our 7 News medical consultant, Dr. Cedrek McFadden. We're talking a little bit about two things that are kind of piling on at the same time. We've got COVID and all the isolation that's been associated with that, with people trying to stay safe and stay away from the vulnerable populations. Then we've got the holiday season coming, and sometimes that can be a very lonely time. So you combine those two things, Dr. C, and we could really be in quite a mess for some people.
We could be. Often people think that loneliness and social isolation are the same thing, and they're technically not exactly the same. Just think about it. You can be in a room completely surrounded by other people and still feel lonely. Likewise, a person can be all alone, no one else around them, socially isolated, but then not feel lonely. So they're not exactly the same thing. Loneliness is defined as the feeling of being alone, or some people will define it as not feeling like you fit in or belong to the people that are surrounding you. So a little bit different terminologies that people then like to interchange with one another.
Well, what about who is vulnerable to loneliness? I mean, is there a particular type of person or group of people that we need to worry about the most or think about and help?
Well, the first thing that most people think about are older adults because they're very dependent on family members, they're dependent on support from community services. So we've taken a lot of that from them already. 40% of older adults report feeling lonely, but it's not just the older adults. 1 out of 3 Americans over the age of 45 also report loneliness. And let's not forget about before this forced quarantine or separation, there were people who already had feelings of loneliness that it's only gotten worse with what we've been going through, and people who already had, mental health disorders. They also perhaps are more prone. So the key is social distancing and social separation does not necessarily have to mean social disconnection from one another.
That makes sense. We talk a lot about loneliness, and people know obviously it doesn't feel good to feel lonely. But what about your health? Does it have impacts on how you are in terms of your physical health?
Well, surprisingly, several studies have shown just that. You can actually have increased risk of infection because of chronic loneliness. There have been studies that have shown that your formation or development of white blood cells, which help us fight infection, may be reduced when you are chronically lonely. You also may have increased risk of diabetes because of altered levels of cortisol, which is a stress type hormone. There are also increased risk of dementia present in people who are chronically lonely. So all better reasons to understand why this could be a long-term problem.
So, how do we recognize it? What are the signs of loneliness?
Well, it depends on which age group we're talking about. In children and teenagers, it may be very different. You may see signs of emotional or behavioral problems, such as difficulty getting along with others, or perhaps you're having constant calls to the school. Those may be signs that there could be some loneliness there. And people who are older, there may be eating disturbances. Perhaps you're eating more, you're having difficulty focusing, or you're sleeping poorly. There also may be more agitation or depression, or perhaps even poor self-care or neglect. And those are signs that you could be experiencing loneliness even above the ages of 18 and 49.
Now, when it comes to the body sort of recognizing and interpreting loneliness, like what happens?
Well, this is a very interesting thing. There was a study recently done at MIT that actually looked at 2 different groups of people. They looked at one group of people that they had fasted from 10 hours from any food, okay, so it kept them from eating anything at all. And there was another group they compared who they forced social distancing, forced social isolation on them. All right, they looked at the brain activity in these 2 groups. And after 10 hours, the group that fasted from any food, they were shown pictures of food. And they saw spikes in certain regions of the brain. Now, here's what's interesting. In that same area of the brain, in the people that were forced to socially distance or socially isolate, they saw also increased peaks in brain activity when they were shown pictures of people socializing. And so this type of study shows us 2 things. Number one, it shows us that socialization may be as much of an innate human need as eating or sleeping, but it also supports the theory that people who are forced to isolate may crave socialization just as a hungry person would crave food. So again, this is an innate part of us, the desire to socially, interact with one another, which is why we cannot afford to socially disconnect, even though we may be forced to socially distance ourselves.
It is fascinating information, Dr. C. Thank you.
Thank you.